Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to share some advice to getting the most out of your home health physical therapy after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos related to knee replacement surgery, rehab and recovery, frequently asked questions, exercises, and much more. So here's just kind of a list I made of different things that can help you get the most benefit, the most effectiveness, the most efficiency out of your home health treatment, your home health physical therapy in those first few days after knee replacement surgery. Now, of course, not everyone is going to have home health, and you might go directly to outpatient services, but a lot of these things can be utilized for outpatient therapy just the same. So first thing I would say is you are in the early phases of your recovery. You probably just got home within the last few days, if not a day ago. So make sure you write down any questions, any comments, any concerns that you possibly could think of so that you can ask your physical therapist when they come in to see you for that first visit. There's probably a lot of things that you probably had an information overload before the surgery. You just want to make sure you are on top of some of the most important things that you need to know and need to be aware of early on in this early phase after surgery. You also want to make sure you're wearing nice, comfortable clothing that allows you to move your legs. If that's shorts or some sweatpants or yoga pants or something like that. And just so you can move your knee, move your leg effectively. You can walk around if you're doing some walking, and the therapist can kind of access the knee and take a look at the knee and do their assessment and examination. And also you want to wear some sneakers ideally, or have some good footwear available. You're definitely going to be getting up and walking and moving around the house a little bit, so having good closed-toed shoes with a heel that are well-fitting is going to be helpful and beneficial. Next thing we want to talk about is your pain medicine, and make sure you're trying your best to time up when you take your pain medicine about 30 minutes or so prior to your appointment. And this is just going to help to, of course, alleviate any pain and discomfort, at least as much as we can right now, and hopefully tolerate as much of the physical therapy, the exercises, the movements that you're going to be doing. The more that you can get out of your therapy early on, the better your recovery and your prognosis is going to be in the long run. And look at any of the exercises or activities or advice that you received from the hospital. So if you were told to do certain exercises, try to do those exercises a couple of times a day prior to your first home health appointment. Try to do those management techniques. If that's elevation, icing the leg, things of that nature, make sure you're doing those things. Don't wait till that first appointment. Start getting the ball rolling, getting the recovery rolling early on, as early as you can, is going to be the most helpful. Set up some space for your physical therapy. So if that's making sure your bed is made and you have a nice, good area on your bed to lay down, maybe it's a different area of your home, making sure you have a little bit of floor space if you can, if you're going to be doing any type of standing exercises. A lot of times the therapist might utilize having you hold on to the kitchen counter or the kitchen sink, so making sure you're kind of decrease any clutter and have an open area available to use. That can be really helpful and just make the first appointment and those home health appointments a little more efficient. And just make sure you are aware of any resources you have. So if you have any equipment, maybe some dumbbells, maybe you have some TheraBands from previous therapy, maybe you have your walker or your cane or other assistive devices. Have those things readily available and have the therapist go over using those with you. That can only be beneficial and helpful. And if you have a support system, a support person, a spouse or a family member or a neighbor, it can be really helpful to have that person available and just a second set of ears to listen to the instructions, listen to the exercises, to make sure you kind of have all your ducks in a row and you know what you need to be doing after your appointment is over. And then the last thing I would share is just make sure that you have the contact information of your therapist, of your healthcare provider. a lot of times you'll seem like you know everything that's going on, you got everything down pat, and then the therapist leaves and you go, oh my gosh, I totally forgot how to do this exercise, or I totally forgot what they told me about such and such. So, give them a call. They are most likely going to be perfectly okay with taking a 5-minute phone call to help answer a question or two. That's only going to help you get better, and that makes them look better as well, as they're helping get people better and recover after surgery. So I hope this gives you some helpful advice, some helpful tips for your home health appointment, your home health physical therapy after surgery. Please be sure to leave any questions. If you had any other thoughts or any ideas or good tips to share with people, I'd love to hear them below. Remember to hit that like button so we can share this video with other people, and I thank you very much for watching.